And we got Northeast Circle back.
Okay. Good morning, I should say good afternoon, everyone. This is the Council for Human Services, Thursday, October 23rd, 2025. Monthly meeting. My name is Veronica Volchik. I'm the chair. We are on Pleasant Street in room B. This meeting is being held in a hybrid fashion, so all votes will be done by roll call. And the first thing I will do is establish quorum. And up on the screen, we have some glare, so please help me. I see Sue Minthinen
Present.
and Deborah Goodman.
Present.
Right, I don't think we have any others up on the screen in our room. We've got Amanda Wright. Present. And Suzanne Keating. Present. And myself, Veronica Volchik, so we do have a quorum. And representing the town, our staff is in the trailer, we have Jericho Mealy.
Hello.
And Alexandria Richards.
Here.
So I don't believe we have any members of the public up on the screen at the moment. So let's move on to the acceptance of the agenda. If I can have I can have a motion.
And make a motion to accept the agenda.
All right, can I have a second?
Second.
Okay. All right, by roll call, Suzanne,
Aye.
Amanda,
Aye.
Sue,
Aye.
Deborah,
Aye.
myself. So we do have an agenda. Thank you. Approval of minutes. We have minutes from 9/11/2025 and 9/12/25 that was put together by Lexi and sent to us. Do we have any a motion to accept those minutes? Can I have a motion?
So moved.
Okay, Sue first, and can I have a second?
Have a second.
Okay, Suzanne. All right, so Sue,
Yes.
Deborah,
Yes.
Amanda,
Yeah.
Suzanne,
Yes.
and myself. Thank you. And thank you as always for putting those together. Appreciate that. I don't see any members of the public here. So I don't think we have a need for public comment. So going on to our next item is an update on the grant applications for fiscal year 27 for the town in Nantucket Services and the substance misuse grants. Everyone, so the closing date on the grant applications was last Wednesday, which was the the 14th. And we received a total of, I believe, 22 applications over the two areas. I think it was 22.
Yeah, I believe so.
Right? So
23 actually.
23, okay. We have some new organizations that have come to us and some people that have applied in the past and have received grants in the past. Everyone was emailed the grant packets. It's quite a hefty printout. This is my copy here. I like working with a hard copy because I can go back and I can circle and whatever. Digitally, it's fine for just doing a quick read. I think we're sitting with.
Everyone's waiting to go.
Thank you.
What do we have? Okay.
She did email just a few moments ago saying she was gonna be a few moments late.
Okay, so Tara Rastiri is connecting. Are you with us, Tara?
She should be in now.
Okay, Tara, are you with us?
Yes, I am here.
Okay,
Just trying to get my act together.
that's okay. I'm 72 and I still haven't done that, so it's okay. All right, so Tara has joined us at 12:09. We are on item 5, just starting to discuss the grant applications that were received last week and everyone has gotten them in the email from Lexi. Of course, we have more ask than the amount of money we have to allocate.
1.1 on the 650. 1.16, actually just under 1.2 now, $1.2 million in requests on the 650K, and I think we're at 190 something on the substance misuse. We're closer on that one than we are on the others.
Okay,
How much is so it's 650K and then
650K and then
175.
175.
75.
right. So, in both categories, we have more ask than money that we have. So just to review, the process. Back in September 25th, I think it was, we had a applicants information session, which was attended by quite a few of the applicants. We just did an overview of the process this year and talked about some of the changes. So notably, some of the changes are, we have put a limit of $100,000 on any one application. That was the first. The second, we have a new grant category that is called operational grants. So we have what was traditionally the human services grants are program grants. We have a new category in the human services area, which is operational, which basically, there's some limits on that, to apply for an operational grant. You need to have $500,000 in your operating budget for the year. And the purpose of that is they're well-established, long-term organizations that are looking to build capacity. It may not be developing a brand new program or funding a relatively new program, but for things to shore up so they can offer more services. We do have some applicants that applied in the operational area. So that's operational, and substance misuse, basically is the same as we've been doing that, except that there is $100,000 cap carries over to that also. We have a schedule with CRC set up that tomorrow is a CRC meeting, and for our first round of reviewing applications, we're gonna be talking about the substance misuse grants. During that meeting, all of the CRC members, are expected to come having read and reviewed and come up with questions. And that will be discussed tomorrow. What we'll also do tomorrow is
What time is
There-
that meeting tomorrow?
9 a.m.
No.
9 a.m. There were 9 until usually 11, but maybe a little bit before, but we will not go over 11 o'clock. The other thing that we, in discussing the grant program for this year, there are some grants that we get that, I'm trying to, it's not that it doesn't deserve a complete review. We review it, but they're standard applications and they apply every year. It's basically the same amount of money. And I'm just thinking of, and I'm gonna pull this organization out, Martha's Vineyard Community Services. Every year, and now I've been doing this, I guess this is my 4th or 5th year. They ask for under $20,000. It basically is funding the programs that they bring people over and supporting our special needs population on the island. And it's standard. So we aren't gonna probably do, we aren't gonna require those individuals to come for an interview. We will read them, and if there's anything that stands out, of course, we will ask, but we do have a few of those that are just the standard every application. Interviews, we will ask every operational grant application to attend our interview. And we will ask any new organization that is applying to attend the interview session. And if there's questions that come up as we're reviewing the grants, if there's questions, we will also ask those organizations, but we're not going to require an interview for everybody. By attending an interview or not attending an interview has no bearing on the grant award. It's just that, if the application is complete, we have no questions, we won't require the person to come in or the organization to come in. And those interviews are gonna be on November 14th from 9 to 12. That is a little bit longer of a meeting because if we allocate 10 minutes per interview, just to get everyone, it's gonna take 3 hours. But we're gonna try to get them all done in that one morning. So tomorrow, the 24th, is operational grants. Next week on Halloween, on the 31st, is gonna be the program grant reviews. And the following week, on November 7th, will be the operational grants,
What date was that again?
November 7th.
Oh, the seventh.
Operational. So the next, actually, CRC has meetings scheduled for the next 4 Fridays from 9 to 12 or 9 to 11. And the hope is that by November 21st, when we have our deliberations, we will be ready then to write the report, to have it submitted to finance in the town by the end of this year. So by December 31st is to have that submitted. We are we've been crunched in this whole process. Historically, we've been doing deliberations in January, interviews in January, and writing the report in February sometime, and going to finance in March. We've been requested by the town that they would like everything submitted by the end of this year, so we'll get it done, and it's and actually there's some benefit, the way I look at it, as doing it in a specific time period, get all in, and then we can say we're fine. And as we've stated to the agencies, and that we should all be aware, we're working under $650,000 in awards for human services and 175 for substance misuse. And the awards, even though we will know by hopefully in December what awards we are recommending, it is a recommendation, and it doesn't become awarded until town meeting. All of the grants that we award become or recommendations become part of a warrant. I think it's warrant 9, I believe, warrant 9. And for the people who attend town meeting, and I encourage everyone to be there if you can, and I encourage not just members of our committees, but in general, because this is an opportunity that we have to exercise our form of government. We learned, I think, a lot in this past couple of years. With our last town meeting, we did have people call the warrant and then express their opinions about who we were giving money to and who are these organizations. So, that sort of led us to, it was like a aha moment for us that we really need as the town to advertise and let people know who gets money and who is being funded. An outgrowth of that was our award ceremony that we did in September. And I appreciate people who were in attendance for that. We got some excellent feedback from the town administration and from the organizations, and we did receive some nice press on that. So we want to continue doing that because and I'll defend the people who call the warrant without having any knowledge of what it is. They looked at the name of an organization and said, why are we giving money to X, Y, and Z? And we gave explanations and that was it. So there wasn't a debate that came from that, but the town many years ago, and it goes back to 1986, I believe, has started to fund not-for-profit organizations. Because it's recognized that this is a vital service. But not all of our taxpayers understand that or know what's happening. So I think it's our duty to inform and support these organizations. So that's my spiel on that.
It was a solid one.
Yeah.
If I may add one or
Yes.
two things, so with respect to the recommendation becoming an allocation at town meeting and then becoming official at the beginning of the fiscal year with the signing of the grant agreements with the various agencies and organizations, that's when we get a chance to determine what the reporting terms are. If there are going to be limitations on what funding can be used for outside of the operations grants, that's when we determine that with the agency involved. And then that gets signed, returned to us, and then there's quarterly reimbursements from the following year. So the grants that were made last year are doing their first round of reporting right around now. There'll be a quarterly report review for those. Then the money is approved and released to the agencies as reimbursement. But one or two things that will help, some of you may know this already, but this is very useful information for any interaction with a municipality, basically anywhere, but especially in Massachusetts. Towns can't pay for anything in advance. So we can never give money under normal circumstances. We cannot give money ahead of receipt of a good or a service because that breaks procurement law. And technically all of our grants fall under procurement law. So we can never pay ahead of time and we can almost never pay in the fiscal year that a request is made. Everything has to go forward a year, has to be reallocated, and then needs to be confirmed with a signed contract / grant agreement for the next year. And then unfortunately, next year, the packet and application process is going to be a little simpler because next year we are finally going to be pushed onto the procurement software platform that finance has had cooking around. So there'll be a web interface for most of the grant stuff. Suzanne, you already used it for
For the needs assessment.
assessment.
Can I ask one question?
Mhm.
Just with the organizations and the financials they report,
Mhm.
are they asked to also report what they get from fundraisers?
Yes,
For the application, not in the quarter.
in the application, but not in quarterlies. The
Okay.
application, we do ask, I think we go back 3 years.
Total grants received in the last 3 fiscal years.
Yeah.
And then do they know, like, we did this fundraiser and we're allocating this money towards this service and this service?
We don't get that
We don't.
level of detail.
But just-
We
Yeah.
may consider stuff like that for operational grants, but for program grants, our due diligence begins and ends with the program that's being done on it. If there is money being depending upon the terms of the grant agreement. So if somebody proposes a three-part program.
Yeah,
We can allocate funding between those three parts, and then they cannot spend money outside of that limit over the course of the contract year.
but what happens if they're using money from a fundraiser for certain services and they're also asking the town to provide money for those services?
As long as we believe the grant application is valid and useful and that it's a good bang for our buck, then that's not a problem. It just means more money is going to it. If there was a reported shortfall in the application, and then that would be. Once the agreement is signed, unless there is something truly significant, it will run its course, but we note that for the next year when we're looking at allocations and grant requests.
But don't like fundraiser donations should be noted and what we.
Total fundraising,
Right.
total fundraising will be in
Okay.
all of the all the agencies have to fill that section out.
Okay.
Quite a few of the agencies have not, one or two of the agencies have not applied for anything in the past, though, so they're just goose
Yeah.
eggs.
I just don't know if all, I mean, I'll have to go look at if all agencies actually did report some of their fundraisers.
More like
Something to be mindful.
what my review, everybody had some data in there.
Yeah.
And that was one of the things we were looking for, is to
Mhm.
try and find like alternate funding, sort of like to not just rely solely on
Yeah.
us for something.
Right.
But if you know anything, let me know.
I noticed a lot of them did, but I didn't read all of them,
Yeah,
Yeah.
so.
Yeah, and I think there was a significant effort put in to improve the application this year.
Yeah.
And looking at the organizations filling out the application, the majority of them followed the directions, which honestly, it is one of the criteria that we have in our rubric, because initially, and I've had this conversation with people, that if you give instructions of what to do in filling out an application, and if the applicant ignores significant questions or doesn't follow format, what that somewhat, it's a red flag. Are they going to be able to manage the grant?
Yeah.
And the reporting, et cetera. So it is one of the criteria that we judge on. And let's just talk a little bit about the rubric while we have this conversation going at this point. The rubric has been expanded. I think we have
Seven categories now?
seven categories. I think I've got that in front of me here. And the rubric is number one, it's been a few years that we've been using, or at least we've attempted to use the rubric. Last year, it was used in its entirety for the first time, I think. Maybe it's the second, but it was there. And the rubric is an effort to make subjective areas be more objective. And it becomes a valuable tool in deliberations. There are sometimes in deliberation other conversations and questions that come up. But one thing we're going to be putting into play some new guidelines for deliberation, that if the results of deliberation varies greatly from the results of the rubric, there needs to be, exactly, there needs to be significant discussion of why. Because with these seven categories, each reviewer does it independently. We submit our scoring to Lexi ahead of time, and she then collates all the scores. So it's an average score that we're looking at. So if, and so what we get is a document that pretty well ranks organizations with their applications, in a numbering system. And for the most, it's pretty on target. And so, first of all, you know, as I said, if the deliberation shows that we are way off what this, it's a red flag and we need to have more discussion on that before that becomes. And the second point with deliberations, we're dealing with our CRC right now. We have 6 members. We still have an open seat that should be filled by economic development,
NPADC.
MPEDC. And so we're going into this deliberation with only 6. Ideally, you want an odd number. But we are also going to put a I'll call it a rule, but I know someone will correct me on that. That we will not do deliberations with less than 5 people in attendance.
Yeah, because didn't that happen last time?
Yeah.
Yeah.
Yeah,
I think
and
that's
you know,
important.
it doesn't, it makes it much more difficult, and we need to have a minimum of 5 to do deliberations, and that will be discussed tomorrow. Also,
I
question,
have a question about the number of categories. I only have 6.
Yeah,
Said
sorry,
there were 7.
there's 6 rubric categories.
Six.
It's the focus, partnership, innovation, cultural relevance, financial. Oh, there's one more on the operations.
operations.
There's a
that's number
special
7.
category.
Oh, okay,
Okay,
that's right.
That's why there's,
That's
so
right.
there's 6 and then
Okay.
there's 7.
A scale, I think, that's right.
Yes.
Right,
Yes.
right.
And then
I forgot.
more generally, the arrangements between the contract review committee and the Council for Human Services is oversight's the wrong term, but CHS is the body that looks at the larger picture, whereas CRC is the body that looks at grant proposals. So at the end of this CRC cycle, we're gonna do a lessons, kind of like lessons learned process. And then we're gonna look at the rubric, and then this body will evaluate the rubric, and then work with CRC to determine if we need to tweak the rubric, because the rubric needs to change. At least, it needs to be examined for change every year,
Right.
because we didn't do that, and our rubric stayed the same for 15 or 20 years. So now, when we do the end of this year, we'll look at the proposals, we'll look at what we approved. We'll see if there were rubric questions we could have tweaked, or more likely rubric answers, the evaluative criteria. That's something that we need to work with CRC on, because one of the problems with the opioid remediation grant process was that the rubric could have been more tightly written to that specific grant proposal, and that made it confusing to evaluate the grants. So we spent more time on rubric evaluation and education this time, and then work out a new set of rubrics to evaluate the.
And, you know, as an example, the rubric was revised, this cycle. And, Sarah Wright is on vacation right now, but she spent a significant amount of time in researching and then worked with Jericho and I to pull that together. So a good point. This is the organization that is, the holder of the grant process and applications. The CRC, their role is to evaluate the grant applications. And that's goes back to our original charter, and also it was reinforced with the consultant group that we had come in and look at our whole process. So, in our last meeting, we had, during the summer, had asked people to look at our different categories. And in our last meeting in September, we assigned members of CHS to different segments of the human services world. There it is, thank you. Good. And I believe that Lexi had included this in the packet, so it came out in blueprint like this. So everyone has their assignments, so as an example, that tomorrow CRC is looking at the substance misuse grants. Deborah and Amanda are in the substance misuse focus area. Either from interest or in work abilities. I'm not sure what word that would be. So, knowledge of the whole area. So, and this actually goes probably into the next item on our agenda, which is the assignment for study groups. And we have touched upon it already, is that everyone has received digitally copies of the applications. The areas that you're assigned to, what we're asking is to read them, and if questions come up from your view of different areas, submit them to Lexi. And they will be incorporated into CRC's review. And if we don't have the information, they potentially could be a question that will be given to the organization ahead of time for when they come in for an interview. And we're going to make sure that people have the questions before coming in for an interview. So, except for someone that's new and if there's an application, we have absolutely no question. They're just gonna come and do an overview of their organization. So we get to see them face to face, know who they are, and get a little bit more of a sense. But if there is a question, they will get it ahead of time so they can come prepared to give us the information that potentially was lacking in the application, or sometimes the application will lead to another question. So, but we do want to have them to the organizations before they come in so they can be prepared.
So when do you want the CHS to submit the questions by?
We want to give about a week notice, ideally.
Right.
A week before the interview?
So the idea is to get, especially for the more complicated or data-driven questions, it might take some preparation time. Like if you're looking for number of clients or average amount of time spent with a client or anything like that, that can take some time to dig up the information and prepare. So ideally, we would want to get the questions in about a week ahead of.
So the drop dead date should probably be November 7th.
Yeah.
For any questions, and if you have them beforehand,
You can just
please
send them.
submit
Yeah.
them.
I'm
But-
gonna ask you guys to send them to send them direct into Lexi. Make sure you do not CC more than 2 people who are
Right.
on the committee. Ideally, send them in directly. If you have communication that's traveling, Sue, I'll get to you in just a second. If you're having communication that has a variety of people CC'd on it, it counts as communication that needs to be during a meeting.
Right,
So
and
that's something to
actually,
be.
if I can just refresh people also on that. When Lexi, the reason why we have Lexi sending out all this information, she's our administrator, and she can communicate to the entire group. If I communicate to more than one person, it then becomes a meeting. So when you are responding to anything that Lexi sends out, please do not copy all. Just send it directly to her, because we aren't necessarily the organization that there would be, requests for public information, et cetera, but it does complicate things, so, just a reminder, when you get information, she'll send it out to everyone, but when you respond, do not hit all, just respond directly to her. Whether it's about a scheduling thing or whatever, but just a good reminder for everyone. Sue?
So my question is, one of my assignments of study groups is emergency. Is there a way to know which of these is emergency? Cause that's like such a, I don't know what kind of topic, but
So they're all self-identified and it should be an exhibit D, but things got a little weird with that part of it. So I'm gonna run through these to split, to figure out and get maybe a list of what's in each one.
Yes.
But in the exhibit D, we identify the applicant is asked to identify what category they place themselves in. It was just purely a self-identification. And it should be the first question in exhibit D.
Some of them did it and some didn't.
Some did and some didn't, yeah.
I mean,
So
I know
as-
from experience,
Yeah.
sometimes you feel like you're 6 different categories at once, cause
Right.
And we allowed for multiple categories, like that people have, I know of at least 2 agencies that their programming applied to 2 sectors. So we're,
Mhm.
that one will be dealer's choice, basically.
A good example on that, a safe place, and they self-identified as emergency support.
Okay.
So that's,
But if
so
they have identified, then how do we determine what category they go under?
We will, I guess. But Sue, specifically, I'm gonna run, I'll try and run through and do the ones that self-identified. I'll see if either myself or Lexi might be able to do that. And we'll get that, we'll try and get a little thing up and sent out to everybody with where we've categorized things.
I'm just trying not to print out 200 pages of stuff.
Yeah, and we appreciate the.
The
Earth-
trees appreciate it.
Exactly.
Marvin appreciates that
Um,
for sure.
I have a somewhat related question. So I know what categories I'm on, children and youth and behavioral health. But let's say like tomorrow is the substance misuse CRC.
Mhm.
Are only the 2 people on that committee or assigned to that study group, the ones that need to be familiar with that and present it, I mean, I will read through all of it.
Are you talking in, which hat are you wearing?
Okay,
Okay, yeah,
right.
it's my CHS hat, wondering what I'm doing in CRC.
So, I
Okay,
gotcha.
Yeah.
See, as a member of CRC, we are responsible for reviewing all.
Oh, okay.
In your CHS hat,
Mhm.
you're gonna go deep into just your area
Okay.
of whatever, but CRC, we review all and we discuss all. So,
I've already gone over my paper limit with HP.
Yeah, it's crazy that they actually charge you per page on top of charging you for paper, on
Yeah, I
top of
know.
charging you for ink.
Oh, Hewlett Packard.
Hewlett Packard, the
Oh,
printer
it's
company.
all in printer company.
right,
They get certain, they do your ink thing, but you say, I'm gonna use 100 pages a month, you go over it and they start charging you per
It's-
sheet.
It's a subscription plan,
Oh, is
the
it
printer that you purchase.
really?
Yeah,
Wow,
Monopoly is a fun thing.
I guess I have a brother printer, thank goodness.
Brother is good for now, but
I'm sure
they're
They're all gonna jump on
Yeah.
that.
there's a private equity firm, I think, looking to purchase Brothers specifically.
Wow,
I don't know, some of them, they can retroactively add that to your machine. Depending on what if you click to update your license, because they come down with a new software to manage the drivers. Part of that end user license agreement could be agreeing to participating to arbitration in the instance that you contest the new subscription terms. But anyway.
no, I don't have one.
I try to not print anything out because Rico is not my favorite company.
Do we advertise that on the current?
I don't
Okay,
like,
I
I'm
said,
gonna, It's
Okay.
neither endorsement nor anti.
Okay. So getting back to our conversation at hand here, any questions or any comments up until this point? Okay. Thank
I
you.
think for you guys, basically just figure out the categories that you signed up for. And try and think of a couple of questions that are not answered by either that the proposal does not explain to you. Or that you have on the general program or topic of the grant request. You know, the idea is we want to have a good picture both of what the proposal is and of what the needs and situation on the island is. Because the role of the CHS is the oversight-ish / advocacy for general services. Whereas CRC is specifically the application, grant, and evaluation of programs.
Okay. So next on to update of needs assessment.
I can run that one. We had Marcos on island, was that 2 weeks ago?
Yeah.
Or 3 weeks, 2 weeks ago. So we had Marcos on island for about a week. He did a bunch of primary interviews. It was more of a location survey at this point and making some inroads to distributing the needs assessment paperwork and the links to the survey instrument, as well as I think picking up the intangibles that are Nantucket. Like he had to leave a day early because a nor'easter came out of nowhere, which is something that you can read about, but until you see it, it adds a little bit of flavor. I think we are at somewhere around 100 respondents at this point from directly. I need to double check with him on that. And he's reaching out to the to the provider surveys. So if anyone has not, anyone working for a nonprofit has not talked to him yet, you should have reached out. And I think we sent a reminder email out to those stakeholders a couple of days ago. If you can think of anyone that he should talk to for a stakeholder or a agency meeting that he hasn't yet, let me know and we can set something up with Zoom. He is intending to be here on in the spring again for a brief visit where it'll be a wrap up and then any follow-up, because we're going to do the two periods of seasonal worker need assessment. And then we're also going to do, we're going to have the survey open all winter long.
Is there a list of who he's reached out to?
We should have that. I think like I have the stakeholder list and I think did he send us the one that he got responses back from? Yeah. We can share that. We can share that.
Assume that the stakeholder list includes over the last period of year, anyone.
Everybody who's applied, everyone who's applied.
Even if it's not in the last year or whatever, but any organization or basically any not-for-profit on the island.
Yep, I mean, any not-for-profit on the island is encouraged to do the provider survey. And if they have anything else, or if members of this body or members of CRC can think of agencies, I cast a broad net, but I also work with the steering committee to get as many things I don't know about onto the list and as many people, community and locations as possible onto the list. But it's never going to be extensive. And then Tara, this is partially related to the update. We've got a commitment for radio ads to support the survey instrument that will be going all winter. They should be running from basically, they'll be starting about 5 or 6 times a day as soon as we get the financials ironed out on this and record the radio spots. I believe Roberto is going to record the Spanish language one, which we running on the Spanish language radio station. And then unless somebody else wants to record the English one, that is fine with me. But if no one else is around, I will do it. As I have a face
We
for
also
radio.
do Portuguese.
We do not have a Portuguese language radio station
Okay.
to put it on.
Alright.
But we are doing some Portuguese language social media and digital outreach. We just don't have the
Okay,
spot for the Portuguese language. It is translated, the material should be available, the survey should be in Portuguese, as should be as will be like some outreach material. We just don't, I don't think we have a radio spot for it.
Where are people being directed to?
So that actually is a very good point. If you know of anyone who wants to fill out the survey, and you should know tons of people who want to fill out the survey, and you should be encouraging people to fill out the survey, send them to accares.net. There is a banner ad there. I could give you the town URL, but you don't have the 2 days it would take for me to read the URL out to you, the address to you. So we sent everyone to accares.net. There's a banner right below the search box, right next to the calendar of all behavioral health events on the island. You can click on that. It will take you to the page where the survey is held. Also at that page are a bunch of QR codes, which that's what we're doing for the physical outreach and for the social media. And if you're directing people, anyone, you can just pull up the QR code and then it takes you direct to the survey. We will have some preliminary secondary research and some amount of survey responses before the evaluation process begins. Marcos is pretty sure we'll have the benchmarking and some comparison data for other municipalities, as well as the initial stakeholder information, stakeholder and survey focus group information. That will be available, I think, hopefully towards the middle or end of November when we start our deliberations.
Is it appropriate, and I'm thinking of organizations that have a lot of face-to-face foot traffic, to have some type of a sign that can be hung, and I'm thinking places like the Family Resource Center, the food pantry.
Addiction Solutions.
Addiction
We
Solutions, et
should have
cetera.
gotten a chunk of those out while Marcos was here. I'm not sure if he made it to Addiction Solutions.
Yeah.
But yeah, I would, it is more than appropriate, is encouraged.
Do you have them and I can get one?
What I'll do is I'll send you the screenshot. The easiest way for me to do it is here, and I'll just show you while I have you here.
If you send it to me, I can print it out.
Yeah, no, and you should, this is as much for everybody else.
We're not on subscriptions at this point, so we can print it out.
Quick,
Alright.
before.
Tara?
It's
you're-
not very intuitive as to where, when you go to accares.net, the survey is. It's really buried. I just feel like,
Should
If-
be on the, what I'm gonna do is I'll ask the contractor to change the scroll bar, so it is the first thing that's seen there.
yeah,
Some limitations, and I'm also gonna see if I can have them swap the 988 response to put
yeah,
that below. But the alterations made to the town webpage are the most that they're going to make to support this. So I had to find something else to do to get this up.
when INM posted it in Daybreak, it was very easy. I will tell you. I mean, it was a one click and it went right to the Survey Monkey. So like, I just
The-
feel like we need to make it easy.
I agreed. The only reason I put this at cares thing in is because I can say it on a radio thing.
Yeah.
And I cannot do the same thing for any of the town URLs. We don't
Yeah.
have a URL forwarding. But I'll make sure that I might actually see if they'll put the QR codes up as banner ads on Network of Care.
I wonder if you could also ask 97.7 and if they would actually put it on their website
I will see what I
as
can do.
part of it.
Is Daybreak and Current, are they sending it out?
They did a couple I saw early on, they did put it out, but it's a question of, I know that when we talk to 97.7, like they can do banner ads and stuff like that too as part of this, but it wasn't, I don't know how we ended up agreeing on if they would do any of the banner ads, if they would do them.
I was just working on the radio part of it.
Yeah.
I'll see if there's the banner ad thing to work on. But I don't have time to run an ongoing media campaign on this for the next couple of weeks, so that's sort of like, I need to get that set up, and so it's more a little bit running autonomously.
I have
Mhm.
yeah, just the Community Solutions has that great meeting once a month.
Oh, yeah, the CFN.
Yeah.
Yeah.
CFN. So if you send it to Tandy,
That has been, we did that a couple of times, and we're gonna have Marcos attend a couple of those meetings, both
Yeah.
in the fall as it winds down, to do like an update and an outreach. And then when we are starting up to do the final collection towards in the spring, as the seasonal workers start to show up,
yeah.
then we'll do another round. We'll have them send it back.
But they just had a meeting on Tuesday, so Tandy sends out the minutes. So you might want to just shoot her an email today and say, can you include this in the minutes? Because it goes out to people off island, on island.
Was Marcos there?
No,
No,
it's just like all the nonprofits go. There was like over 28 people. It's a great meeting. So I think Tandy would be happy to send it out to everybody.
Okay.
Yeah.
Well, and we have.
Excuse me.
Sunny's on the steering committee, so
Yeah.
I think we hope.
I just haven't seen it. That's why.
okay. Deborah?
Yeah, I just wondered, maybe it was discussed previously. Is it only going to be a QR code, or are you going to be handing out hard copies to people who perhaps don't like to
Hard-
use computers? Yeah, I'm thinking more like the elder community out at Salt Marsh, places like that.
So Marcos did, I believe, visit and do hard copy distribution there. Additionally, there's, he did do a bunch of physical interviews and distribution. I'm happy to print those out and get them doing, but again, I don't have time to administer the needs assessment. We have to try and figure out other ways to do distribution, and then when he's on site, we'll do a bunch of physical flyering and papering.
Okay, thank you.
No worries.
Late sitting outside the grocery store.
Is it-
I mean, I
And the
think
dump,
with-
and the dump.
Sorry.
The dump is a good one. The dump is definitely a good one.
Yeah.
Yeah,
I mean, I just think back to the pandemic, when we were all sequestered inside. I mean, like, not that anyone sits out in the cold, but I mean, sitting outside the grocery stores and handing it out to people, and helping them fill it out for those that aren't computer savvy is a great way to get people to do it.
I agree.
And Cumbies, patches.
yeah.
And when you hand them out, where do they drop them off?
Well, I don't know, I'm just,
So the idea is, due to labor restrictions, like the fact that we don't have to physically input hopefully hundreds of these results, we're trying to direct as many people to the QR code as possible. And then we go to physical locations in order to hand them out. And then I think when Marcos was here, he was doing the data entry himself afterwards. He was just putting it in afterwards after we fill it out. If anyone wants to help me do that, then I'm happy to try and set stuff up. But I have not had time to dedicate solely to this, which is one of the reasons we went for the contractor.
I thinking that this Saturday is a vaccination clinic. And even though I personally can't be there all day, but maybe that could be something I can do in the beginning. If you give me,
I can do
A
a step with
device,
QR code.
we can have people if I'll approach them if they will do it right there.
Yeah, no, I
so
think that's a good
anytime we
idea,
have
actually.
Gatherings of people.
yeah, I know, I wish we had done it, been able to do it like the senior fair, because that was well attended.
So a little QR code, ignorant. I know I can hold my phone up over a QR code and it will send me to a link.
Yep.
Right.
And then, but if I'm standing somewhere, how do I fill out the form on the link?
So if you want to
What,
fill out,
what do I
the-
do with it?
if you want, so if the person that you want to take the needs assessment survey has a phone, you just pull up the QR code and then they take a picture of it. It takes them direct to it.
Okay,
If you're gonna fill out a survey for someone through your phone, you can just click on the link and then you just you just ask them and they fill out.
so they fill it out on their phone,
On the device.
on a device, and
And then at
then,
the end, it's just click
says
and it's
Send,
sent.
yep.
Okay.
okay.
For the
got it.
physical copy, what you essentially do is you get the questions and you write them down, and then you then go to that web page and you enter that information in. You're just doing data like writing it down and then copying
It's
it
like an
over.
old school data.
Yeah,
collection.
Yeah.
okay.
I have
did.
to hop off, but could we hand
Okay.
out a QR code at town meeting?
Yes, we
Just-
absolutely could. And I've seen
Just
it.
thinking, coming fast.
I'm not gonna be here for that week. I'm at a conference and then I'm not gonna be here for the week of the 26th. I am finally going to get away to see my dad, so that's why I'm not making a ton of
Good,
plans for that
and
time period.
Unfortunately, I'm not here for town meeting. Could we have a volunteer that would like to be in the lobby potentially? Think about it. We'll send out a email to see if we can get a volunteer to do that.
Yeah.
Okay.
I have to jump off as well, unfortunately. I've got
Okay.
another meeting.
Okay,
Sorry.
That gets us to.
all right, that gets us to the Human Services report. Do we have a quorum now?
We will not.
No, I don't think you will.
Not, so we will continue, but we just won't close our meeting. We won't adjourn. But we should be wrapping up very soon. Thank
Okay.
you for attending. Be well, everyone. Bye. Okay, so let's see if we could send out an email, see if we can get a volunteer for,
We'll send out the QR codes too. We can just pull the images for the QR codes can be in that email.
Is there, yeah, I mean, can you create a handout that you could just give to people?
I'll talk to Marcus about it.
Okay.
yeah,
Cause I think that's a great idea. Cause that's gonna be well attended.
right. Even if we have, because there's people handing out information as you're going in, even if we have a piece of paper that you can just give it to and with explanation, just do this is important, et cetera. That's
And will the town be okay with that?
Yeah, it's
Okay.
a needs assessment. There's
Yeah,
no,
Okay. I
like,
know, I just don't like,
it's not advocating for a particular policy.
it's just
right.
It's data, it's just data collection.
data collection, and we're trying to get as many people as possible.
Yep.
So that is gatherings where we have
Yeah.
lots of people, and that's probably the biggest gathering
Yeah.
we will have. between
Special
now
town
and
meeting?
May.
Yeah,
Oh, special, you're talking special time.
town meeting.
I heard town
November
meeting, I
5th.
didn't hear
Special
special.
town meeting,
November 5th.
November 5th.
I mean, the
Oh.
big concentrations of people between now and May are gonna be special town meeting, although that's probably gonna have one of the lower, it's not gonna be the most well-attended one, because it's,
It's short-term rentals.
yeah,
I think it's
but
gonna
it's
be-
2 articles. I'm,
They're hot.
I think there's gonna be a lot of people.
I, either way, there's a good place to fly, like
Yeah.
it's a good place to do to do handouts related to
Right, yeah.
this. But then December Delight, like the other thing is that
Yes.
we have already kind of, we already have a lot of those demographics that had gotten direct outreach to. Like the senior expo, Salt Marsh got like 3 days over the course, and I think most of the residents or visitors to that did go through that. Same thing with NCEA. We're looking for unique new.
Has it been sent to churches?
Yes, Marcos went to a variety of churches.
Okay.
We were trying to work with IFC. We were crossing messages with
Gary?
Father Max.
Okay,
But I think he was away that week. He ended up going to Marcos did do Summer Street Church. I think it did a focus group there. And then I think he also was at St. Mary's with, I think Keziah got him an invite through there, or
Okay.
because since Keziah.
What about-
all the Latino and the non.
Yeah,
Um. Except for the big, the Big Ten or whatever, there's lots of other
I'm
religious
thinking
groups.
St. Paul's distributes like 50 or more meals every Wednesday to people. And then Nourish Nantucket is giving out their meals on Wednesday nights at the school. It could be great to give both of them handouts and they can put them in the bags. So that you're getting to a lot of different people.
Right.
Okay,
And thinking too, food pantry,
Yeah.
we can put those in a bag.
okay. I mean,
And
I
that's that we
can
can get.
provide these for people, but I can't. I can't be like, hey, if you would like to hand these out, you can. I can't ask anyone, I can't require anyone to do anything
No,
like
but if
that.
I can get copies for St. Paul's, I'll bring them to somebody and
Okay.
I'll put them in the bags.
Are we talking about the survey or the QR code?
because
It'll be a
the,
QR
I think the
code,
QR code, but
Yeah.
I mean, it's another way to distribute
Yeah.
it.
right,
and the physical flyer, like we still need the data entry part of that too, if we're gonna do the physical, if we're doing physical copies of the survey.
right, well, I'm thinking just.
QR
do a
codes.
Yeah.
QR code,
So I'll get a PDF,
or I would say,
can manage the
Can
QR
manage
code,
it.
okay.
you
Yeah,
know,
I will get a PDF with the QR codes that's printable.
an explanation that's, goes around just what it is.
Yeah, I
Right,
mean, just
right,
take,
yeah.
this is a needs, and we have the page up for it.
Right,
And I'm just gonna use that because that's the approved copy for it, and that's what the contractor did with us. And then, we'll have that in for everybody. We'll send the email for that. There's Spanish language, there's English language, there's the Portuguese language one should be up there. I'll do 2 different PDFs because each of the QR codes leads to a different survey. And then we'll send that out to the group.
What do you mean by different survey?
So
Like
there's one in
language?
Spanish and.
Okay,
Yeah.
thank you.
So there are 2 surveys in 2 languages with Portuguese as the third language.
Mhm.
There's a year-round or self-identified year-round survey, and then there is a seasonal worker survey. Both of those are in English, Spanish, and Portuguese.
yeah, I don't know if a lot of people know there's 2 surveys. Like, I mean, I'm being naive, but I did not know. I thought there was just one that anyone could fill out.
I
There's,
did too.
I mean,
I thought we were gonna give the same survey to the year round
Yeah,
and then
I
they would
just- I don't-
fill in a box somewhere that said whether they were year round or.
well, you can't
Seasonal.
fill out the same information if you're a seasonal worker as if you're year-round. Like we went,
Okay.
I know, I'm just saying, and I'm not like, I did not know that. So I just, if I didn't, I mean, I would assume there's probably a lot of people that don't know that.
so.
I'm just
the-
wondering if it's advertised to tell people they're seasonal versus.
It's right on the link. So you
I know,
go
but
to the
nobody
page.
are going to the link, that's the problem. I don't know.
So what would you have me do differently about the link? Like, what we've advertised it in a variety of different places. It's going on the radio. Would you want me, like, once you get to the link, or once you get to the survey, you pick year round or
Yeah.
your
seasonal?
No, I
categories,
understand now.
year round or
Yeah.
seasonal.
Okay, you can
Yeah.
do that. when you
Yeah,
get there.
yeah.
Okay, okay.
All right.
I mean, it's all of this, these
Because you're
all
only
have to be
gonna fill out-
self-identified.
You're only gonna fill out
Right.
one.
Yeah. Though, again, due to the methodology of the survey, someone could fill out as many copies of, like, can do as many of them as they want. We have ways to know if they're suspicious looking, like, frequency of data, and like, there's no survey to
Yeah.
do it, but. Yeah, no, there's one of the QR codes, like, you get to the page, or in this case, it's gonna be the PDF that we send out that you print out. Once you're looking at it, there's 1, 2, 3, and 4. One says year-round, Spanish,
Okay.
English. One says seasonal, Spanish, English, and then that's the flyer. Like, I don't know.
And that's what you'll send us.
Yeah,
Okay,
Yeah.
thank you.
and that's where the Act Cares thing leads. That's where the town webpage for this goes. That's where we're gonna be directing people eventually through the radio spot,
Yeah.
so.
And then can we see who he's spoken to? Cause I don't have a feeling he spoke to Addiction Solutions.
I know Addiction Solutions is on the outreach contact form, and we contact Addiction Solutions to set up focus group meetings a couple of weeks before he arrived.
Did they respond?
I could not tell you.
Well, that's what I'm just wondering, because I'm happy to help facilitate that, cause I think that's a whole nother group that would be important to be able to hear from.
I would love to hear from them. That's why we reached out to them.
I know, I just saying, I'm
Yeah,
happy. to-
Addiction Solutions is on the list that responded to the survey.
Did they respond? Okay.
So there's responses from organizations, and then it's the general public.
Yep.
Right.
And what we're really trying to get is a large number of year-round and seasonal residents who can tell us what the perceived needs and what challenges and gaps they face. The agency interviews are important, and the focus group results by sector is also really important, but the power of the needs assessment for us increasing the funding of these organizations and for determining where we direct our efforts is primarily based on the resident numbers, which is the QR codes that we're trying to direct people to. We should actually make sure Addiction Solutions is the perfect place to have those QR codes, because that's a lot of seasonal, like a lot of, not seasonal, a lot of year-round people who wouldn't also be here. But we're not in a rush. We have all winter long, and we just be handing this stuff out. I think that the initial on-site where we get Marcos in front of as many people, that just makes the association with the ongoing communications and advertising for it. It's as slow and steady as what we want to do, and we want to just be handing it out as regularly as we can, and then we'll get the best data. I suspect we're going to get a large spike at the initial part. We're going to get another spike ahead of any of the physical locations we put out, and then we're going to get a large spike when the radio ads are ongoing. The idea is to get as direct a line from the radio ad to the QR code survey, because that's the most number that we're going to get. And then we want to make sure, like we had, Marcos went and did focus group and outreach and survey collection at the Athenaeum for one of the ESL language groups. Like the niches of places that have not been heavily surveyed in the past are the things that we need to get the most data from, because those are the places that we need more accurate information on.
And I know when I saw him I came in he interviewed me, and I think didn't he do everybody on the?
We were trying to get people he wasn't going to be able to Zoom afterwards,
Oh.
and I think your timing worked out well.
Okay.
He's supposed to be reaching out to the people he didn't get in touch with. Like we did that email out, and then to the people who are on the list that didn't respond, and then we're gonna follow up with the agency-based ones.
Well, I know he was pretty happy. That was 2 weeks ago, that he had already had 75 responses
And I think we got
in the first.
we got
Yeah.
like 15 or 20 Spanish language already
Yeah.
off the bat, and that was off of just the initial round. So I think we should be at around 100, I have to double check what the exact numbers are. It's just a question of like the bracket, the frame for the survey, where we get what is it, we get the highest statistical certainty that you're likely to get out of this is 398.
Mm.
So that's the number that we get to have statistical power, or 398 or 498. That's the number that we get where we have statistical power, and we want to make sure we get sufficient respondents from the different demographics that hit the target numbers for that. So we want to cast as wide a net as we can to get as many people who have not filled out a needs assessment survey as possible to fill them out.
Do we want to shut the door signs? I don't know.
Okay. I think that's probably it on needs assessment at this point. Jericho's just left the room. So, I'm gonna skip ahead from the director's report, but, community human services items to discuss by CHS. Anyone who's here have anything they'd like to talk about?
I think I already asked all my questions.
Okay, I just would like to, people have seen in the paper, it's been advertised, you know, fingers crossed, we're all cautiously optimistic that the food pantry will be getting a new home as part of a collaboration with the Land Bank, Nourish Nantucket, the Interfaith Council with NIFRA, and with our new organization doing deer processing. The official name of that organization, Deborah, do you know the official name of the organization?
For deer,
Yes,
deer management,
yes,
I actually think it is the Committee for Deer Management. I actually think that's its name.
okay,
Something
Okay.
along those, but I can find out for you. Yeah.
The nonprofit is
Yes.
AC Deer Management.
Act Deer Management, so I thank you for letting me know that, because I just don't want to refer to them as the deer people.
That's what most people are referring to them as.
Yeah.
So
Yeah.
I saw in one
That'd
of
be
the
close.
publications, it said, oh dear, whatever, but.
there's Nourishing Nantucket, there's the NFFR,
Right.
and then there's, the land bank is the one that's gonna be doing the actual processing and the homeowner, and gonna be the property owners.
Yes. Yes,
And I think they're
So-
looking for a poultry exemption too, to do,
Right.
poultry processing.
as time goes on with that. So cautious optimism, I guess there'll be more, coming out as, that unfolds, but, the property hasn't closed yet, so, that's the next step. So
5 days?
Yeah.
28th.
I think by the end of the month. And at that point, there's a lot of work that will have to be done. And hopefully, I guess some operations can go in a little bit sooner, but there's gonna be some renovations or whatever for particularly the food pantry. But we're all very happy and, like I said, cautious optimism at this point. So, Jericho, your director's report?
Director's report, it's, clinic time, we have the 25th going, that is going to be from 9 to 3. If anyone has some free time and wants to to volunteer, for data entry or greeter positions, please let me know. But that's gonna be Moderna COVID vaccine. Only Moderna, unfortunately, we could not find, it's the only one in the supply chain for us. Then we will have flu, the 3 varieties, for all ages. We can only do COVID vaccines for 18 plus, with the supply that we have. And I think the current recommendations are to, if you're under 18, check with your physician. I don't believe it requires explicit doctor's orders, but we cannot distribute to under 18s, any COVID doses through our clinics.
Right.
Past that needs assessment we discussed, the grant process we discussed, those are the 2 biggest things in the human services world going on right now. And I don't think I have anything else major to update on.
On the COVID vaccinations, anyone over 18 can get it.
Yes,
So that you don't need to have a prescription from your doctor.
the way that it worked out in Massachusetts at least is that the head of the Department of Public Health is a doctor and wrote blanket orders, which were then
Okay.
supported by the governor. I do not, it does that. I don't know if that works for under 18s or whether or not just our vaccine program has has decided out of like efficiency to not do the under 18s. But I would recommend that if you do have anyone who's under the age of 18, that you talk to your doctor about getting them vaccinated. And I believe it is available in pediatric care.
Okay, so just back to the 18 plus, that same holds anywhere in Massachusetts? Or is it just with our clinic here?
It's just with I do not know if it holds elsewhere.
Okay.
It was a state guideline for our clinic on this. But I don't know if at a pharmacy chain it may be different. Or if there is a vaccine for under the Vaccine for Children's program, if COVID is included in that, if that's an exemption.
Unfortunately, there's a lot of confusion over
Yeah.
all of this, and
I
it's
can,
way above our pay grade,
Yeah.
unfortunately.
I can give a COVID vaccine dose to anyone over the age of 18, and I can give flu down to, I believe it's for the 5 and higher age category, the pediatric dose.
So you've got the clinic this Saturday. Is there another date also?
Nothing as planned.
Okay.
In previous years, there was a state supply of both flu and COVID vaccine. There's a very small state supply of flu this year, but I can only administer that to uninsured people. It doesn't even apply for Medicare or Medicaid anymore. So we had to privately purchase the supply that we have, and we have a lead and a lag time. And then we have to apply for insurance reimbursement on our own, which we will not see any of that money if the claims go through smoothly for 18 to 24 months, which means that we have to account for every dose that we do this year, and it has to be all under the distribution guidelines that allow us to get reimbursed, so that I have money to buy vaccine for next year.
Right, like,
Yeah.
you know,
I
Thank you
but
for
thank
doing
you,
that.
but thank you.
This was so much easier when my job was needles and arms. It was so much easier. Than having to deal with 50 different insurance resellers to try and figure out how to get vaccines to people.
Well, it's appreciated. Like I said, I wasn't sure when it was happening and I was fortunate that they are available at CVS, off island and up and down the Cape and,
I know
easy to get appointments also.
I would recommend anyone who has a chance to get a dose, either if it's this Saturday or when they're off island, the availability is going to be weird this year for vaccine. I am told that Stop and Shop is coming back to do another clinic date, but I do not know the
Do we know
numbers
how
of times.
many they did?
I've not heard back from the pharmacy chain. I know that they were discussing in the like hundreds of range. And I checked in a couple of times over the course of the day because of the convenience, but I did not get a number. I would guess it was under 100, would be my guess.
What happens for those that can't leave the house?
Anyone who can't leave the house who is currently getting medical service through the Visiting Nurses Association or anyone at home should be able to get vaccinated under the public health nursing contract that they have if they're already getting services through the VNA. If anyone is non-ambulatory, they should get in contact with myself or with Aaron, and we will try and figure out a way to vaccinate them. But they have to be properly non-ambulatory. We do not have the insurance coverage or the dosage to do anything that is not exclusively non-ambulatory transit. If you can make it to a clinic and you're not immunocompromised, you need to this year.
Okay.
It's actually, the resources and availability are worse for vaccine this year than they were like high pandemic.
No, I totally got it. I'm
Yeah.
just curious.
It's
Yeah, because
a
there's
concern.
There's people out
Yeah,
there
they
that are
can't.
at risk, but
It's a concern. Like
Yeah.
if anyone is already getting at-home services through the public health nursing contract, through the Visiting Nurses Association, there's no questions asked. They can have that administered to them during the course of their normal operations. I am scrambling to get funding to pay for
Yeah, no,
the
I'm
services we have. And it's,
well.
So thank you.
Thank you.
well, yeah,
Thank you.
Another big addition to your already complicated.
yeah, no, that's the part that I dislike is the money and funding and
Yeah.
grant stuff.
No.
I give money out a lot,
I've-
actually.
Been cogitating on this, I have two more questions.
Okay,
So in the packet that we have a grant submission review
Right.
worksheet, is that for the study groups or the CRC meeting? I wasn't sure.
that actually is something that CRC used, but it can be just a guideline for you also, because it's the questions you're looking at, what is the strength or what is the, deficit and, whatever. So that's really a tool that was
Okay.
for CRC.
And speaking of that, do the two people working in each department get together and discuss these things? Or they discuss it over Zoom or the phone or?
So-
Yeah, because two people is not a quorum, so, and that's why we kept these groups to two, that
Mhm.
if you want to collaborate, you certainly can.
The
Okay.
one thing.
Deborah, I'll reach out to you.
And the
Great.
one thing,
Yes, I was going to ask about that.
oh,
Okay.
yeah, sorry. The one thing I'd ask is just have something at the end of those meetings to show
Yeah.
like what was done. There's no requirement for that, but I want us to be as above board as we
Mhm.
possibly can and
Yeah.
document whatever we possibly can. So like, that's probably what you could use that scratch paper for, is just your questions. and
Right.
Okay.
Either scan it or send it to me, or just type a part of the
And
selection.
when should this, our review of these applications be done by?
November 7th.
November 7th.
Okay, oh, right, okay,
And then, so because you have two hats.
yeah.
Right.
That complicates things for you a little bit.
Yeah.
Everybody else should be, whatever your questions are, should be submitted if you would like some clarification, and then we'll report back out with the answers to those questions.
Okay,
Whenever possible, we want to ask ahead of time and get the answers back. Ideally, the communication happens via writing. The question is asked and answered via email. We send it out to everybody afterwards, so it's like official and written. Any of those questions that either we don't get answers for or that don't get sent to, we do during the interview. It's just that sometimes they get to be very technical questions that a interview answer is not as good as, like, sometimes it'll be a spreadsheet, a fair amount of the time, actually.
Okay, Any new business? I think we've covered a lot today. I'm looking at my calendar that the next CHS meeting will be on the third Thursday because the fourth Thursday is Thanksgiving. So the next meeting will be November 20th at 12 o'clock. And then actually, if I look at December right now, do we run into that? We're into the same issue that the fourth Thursday is Christmas, so the CHS meeting will probably be on December 18th then also. So just make note of those, because we're getting into a busy time of year. So at least we've got the two next meetings, and I won't confuse things again by, I thought our meeting was last week, and so Lexi kept me in line on that one. I appreciate it.
Yeah, thank you for the email.
So we can't adjourn the meeting since we don't have a
Oh, that's right.
quorum, but with no more comments, discussion, questions. I want to wish everyone a beautiful day out there. And the next time you see me, I will be up on Zoom and while we saying hello, mate, whatever. So and I've looked at the calendar or whatever, so we're prepared to be awake at strange times, whatever. So anyway, be well, everyone, and thank you very much. And we'll see you soon.
Okay.
Thank you. Bye.
Bye, Deborah.
Yearly